Who should be treated in cases of H. pylori infection? Anyone, any person who is positive for H. pylori infection should be treated. Once you diagnose H. pylori, you have to treat, and to avoid the consequences of this infection. Now we come to the therapy of H. pylori infection. We have different regimens according to the drugs was been chosen, as well as the duration and the eradication success. We have different regimen, as we said. The first regimen is the first line regimen, and this includes clarithromycin, it is called clarithromycin triple therapy, including PPI, clarithromycin, amoxicillin, and metronidazole for 14 days, and success rate is very high. This is the first clarithromycin triple therapy. Another one is the bismuth quadruple therapy, 4 drugs including bismuth, and that's including, of course, BBI, bismuth subcitrate or bismuth subaggregate, metronidazole, and tetracyclines are given for 14 days. The bismuth or the third regimen is the non-bismuth based quadruple therapy for again 4 drugs without bismuth. This is including PPI, amoxicillin, clarithromycin, and metronidazole. Then we have the good sequential therapy, which is including two types of drugs. The first for 5 days, including PPI based amoxicillin and PPI and amoxicillin for 5 days. Then is followed by PPI, clarithromycin, and metronidazole for another 5 days. The hybrid اللي هو sequential concomitant therapy, it includes PPI and amoxicillin for 7 days, to be followed by PPI and clarithromycin and amoxicillin and metronidazole for another 7 days. The levofloxacin based regimen includes PPI, levofloxacin, and amoxicillin for 7 days or for 14 days. Levofloxacin sequential is again PPI, proton pump inhibitor, amoxicillin, followed by PPI, levofloxacin, and metronidazole for 7 days. The last regimen is the load levofloxacin plus amoxicillin, omeprazole as a PPI, and nitazoxamide and tetracyclines are given for 7 to 10 days. As you see, PPI is very important in every aspect, or every regimen should be treated, should be included in every regimen. And the other point is which is very important, that we have to extend our treatment for 14 days. How we know the success of our treatments? This is by monitoring. Tests should be used to determine treatment success, and they are to be performed at least 4 weeks after completion of the antibiotic therapy, and after PPI therapy has been withheld for at least 2 weeks. So this test should be done 4 weeks after cessation of the antibiotic or PPI. We have to prevent, so long as this infection, H. pylori, produces such complications as cancer stomach, we have to make some sort of prevention, and this includes in persons living in uncrowded and clean environmental areas, less likely to acquire H. pylori infection. Those people living in good sanitations are not liable to get the infection. And complete disinfection of the gastroscopes, pH electrodes, and other instruments entering into the stomach. We have to be sure that these instruments are very safe and not infected with H. pylori infection. So these are the how to prevent for H. pylori infection. Thank you very much.